Good people, maybe you search acromegaly. What is acromegaly? Pituitary tumor or pituitary surgery? Welcome to the channel. Maybe you've just been diagnosed, know someone who has it, you've had it for a while, or you're just curious. Stick around. You're in the right place. Today, I want to talk about something a lot of us with acromegaly deal with: joint pain. It's one of the most common and stubborn symptoms and doesn't always go away even after treatment. First off, acromegaly is a systemic disease. It affects multiple systems in the body, and no two people journeys look exactly the same. Some are diagnosed with mildly high IGF-1 levels. Others skyrocket into the thousands. In fact, before surgery, my IGF-1 was 1400. Currently, it's 239. I'll talk more in detail about IGF-1 and what it is in the next video. So okay, people, our experiences overlap, but they are never identical. Another key piece: timing matters. Acromegaly usually starts in adulthood, but it can happen younger too. It usually takes about 10 years to diagnose. That delay has consequences. People may go undiagnosed or misdiagnosed for longer periods of time, are at a much higher risk for heart and joint complications. Personal history play a role too. Old injuries, your fitness level, other health conditions like diabetes or low testosterone, all of those can make bone and joint issues worse. Now, here's something important. Pain isn't just physical, it's a bio-psycho-social experience. Let me explain. That means your mind and your body and the environment all affect how pain is felt. And let's be real, surgery isn't always the cure. Medications have side effects, sometimes painful ones. Even IGF-1, when it normalizes, your body doesn't always feel normal. So what happens in the joints? In the early stages, growth hormones thicken cartilage and widen joint spaces. That can make you hypermobile, but as time goes on, those spaces shrink. Bone spurs can form and things stiffen up. Over 75% of people with acromegaly have joint pain, especially in the hips and spine. And even after treatment, degenerative changes often keep progression. There's also the issue of nerve pain. When bones and soft tissue overgrow, they can press on nerves. That's why carpal tunnel is so common in acromegaly. But other nerve entrapments, like in the spine and arms, can happen too. Unlike muscles and bones, nerves don't stretch, which is why nerve pain can be so intense. Let me share a bit of my story. In 2020, I had both hip replaced. And based on my x-rays and ongoing pain in both knees, as well as both my shoulders, I'll eventually need all those replaced as well. Being a little less mobile than I once was has definitely contributed to weight gain and some mental frustrations. Before acromegaly, I was in great shape, strong as an ox, maxing out at 335 pounds on my bench press. But fast forward to now. After 3 surgeries and years of meds, I'm still dealing with chronic fatigue, muscle weakness, and nerve entrapments. Honestly, the pain I live with today is worse than before my diagnosis. And that's the takeaway. Controlling this disease doesn't always mean controlling the pain. Sometimes treatment helps, but other times it creates new challenges. If you're dealing with this too, just know you're not alone. Everyone's pain is different. Acromegaly may change our bodies, and the pain is real, trust me. But every day, we keep moving forward, sometimes slower, sometimes with more struggle, but forward all the same. Our stories carry weight, our voices carry power, and together, we remind each other that we are more than this disease. So if today hurts, hold on, because tomorrow still holds possibility, strength, and hope. And that's something that acromegaly cannot take away from us. Thanks for watching.